Just we have discussed here what are the four cooperating parties for ICD-10 CM implementation. So these are the four cooperating parties: AHA, American Hospital Association; AHIMA, the American Health Information Management Association; CMS, and NCHS. Okay, and as we have discussed previously, we are learning latest guidelines. Okay, so which are started from October 1st to September 30 and ends on September 30, 2025. Okay. Now we have learned this one. So ICD-10 CM organized into four sections. Section 1 again divided into two parts. One is conventions. These conventions are applicable to each and every chapter. Okay. Next we are having chapter specific guidelines. Those are related to only that particular chapter. Okay. And section 2 includes selection of principal diagnosis. Mostly we will use this section 2 for inpatient coding. Okay. Section 3 contains guidelines for reporting additional diagnosis in non-outpatient setting. So section 3 also related to inpatient coding, where using section 3 guidelines you need to code secondary diagnosis. And section 4 is for outpatient coding and reporting. So for example, initially if you go to any interview, most of the time they will ask you outpatient coding guidelines only. So if you are a fresher, if you want to go for interview, you need to concentrate on section 1 as well as section 4. Okay. So why means no one will take you as a inpatient coder at first time. Okay. So it is necessary to review all sections of the guidelines to fully understand all of the rules and instructions need to code properly. Of course, that is correct. Okay. So whenever you want to code any chart, you need to review all the guidelines like normal conventions as well as chapter specific guidelines. Okay. Again, these are the chapters or sections. So ICD-10 CM official guidelines for coding and reporting. Okay. So in the short form, you will call it as OGCR. ICD-10 CM OGCR. So OGCR means ICD-10 CM official guidelines for coding and reporting. Okay. Next, first we'll see section 1. So what are included in section 1? So as we have discussed previously, section 1 includes conventions, general coding guidelines, and chapter specific guidelines. Okay. First, we are having conventions for the ICD-10 CM. Okay. So next, we are having general coding guidelines. Okay. Next, we are having chapter specific guidelines. Under chapter specific guidelines, we have all these chapter 1, chapter 2 like that. So which we will learn gradually. Okay. Like that, we are having total 21 chapters. Okay. 21 or 22 chapters. Okay. So recently they have added this chapter 22 for COVID. So after COVID only they have started this chapter 22. Okay. Next section 2 contains selection of principal diagnosis. So these guidelines we need to use for inpatient coding. Okay. So next we are having section 3, reporting additional diagnosis for inpatient coding only. Non-outpatient coding means obviously inpatient coding. Okay. Next section 4, diagnostic coding and reporting guidelines for outpatient services. So if you are working as a outpatient coder or if you want to go for interviews as a outpatient coder, you need to concentrate on section 1 as well as section 4. Okay. So now we are having appendix I and present on admission reporting guidelines. So these are also mostly related to inpatient coding. Okay. Next section 1. So we will start with section 1 today. So if anyone is unable to understand, please mention the comment section. So I will explain in Telugu or Hindi. Okay. So section 1, conventions, general coding guidelines and chapter specific guidelines. Okay. So always try to remember conventions and instructions of the classification takes precedence over guidelines. Okay. So when an example scenario, whenever you are having different guideline related to conventions and chapter specific, you need to obey conventions, not chapter specific guidelines. Okay, convention supersedes chapter specific guidelines. So you need to give first priority to the conventions, not for chapter specific guidelines. So that they are telling here. Okay, the conventions and instructions classification takes precedence over chapter specific guidelines. Okay, next we are having part A, conventions for the ICD-10 CM. Okay, so what are these conventions? So the conventions for the ICD-10 CM are the general rules for use of the classification independent of the guidelines. Okay, so these conventions are incorporated within the alphabetic index and tabular list of the ICD-10 CM as instructional notes. Okay, so basically these conventions are the rules for both alphabetic index as well as the tabular list. Okay, so you can use these conventions for both alphabetic index and tabular list. Basically conventions are rules. In the layman terms you can call it as rules. Rules to code ICD-10 CM whenever you use alphabetic index or tabular list. Okay, in A we are having first one, the alphabetic index and tabular list. So the ICD-10 CM is divided into alphabetic index, an alphabetical list of terms and their corresponding code, and the tabular list, a structured list of codes divided into chapters based on body system or condition. Okay, so as all of us know, if you are having uh, idea about coding, so ICD-10 CM divides into two sections, like alphabetic index and tabular list. Okay, so whenever you want to start coding using ICD-10 CM, first you need to check in the alphabetic index. Okay, then using that you need to go to tabular list. First step is to check in the alphabetic index. So second step is to you need to ensure and you need to check in the tabular list. Okay, so the alphabetic index consists of the following parts. Again this alphabetic index divided into these parts. So what are those? Index of diseases and injury. So this is most important for whether it is inpatient coder or outpatient coder. Okay, index of diseases and injury, the index of external cause of injury. Okay, and table of neoplasms and the table of drugs and chemicals. So basically in alphabetic index we are having four tables. Okay, first one is index of diseases and injury. If you want to code for appendicitis, so you need to use index of disease and injury. Okay, for example if you want to code for fall, so patient is a 80-year-old male, so he fall on the street, so that time you need to use index of external causes of injury. Okay, next one, table of neoplasm. For example if you want to code for prostate cancer, so you need to use table of neoplasm. Okay, for example if you want to code poisoning or adverse effect of drugs or chemicals, you need to use table of drugs and chemicals. Okay, so like that ICD-10 CM divides into two parts, alphabetic index and tabular list. Okay, and again tabular list this alphabetic index divides into four parts, index of disease injury, index of external causes, table of neoplasm and table of drugs and chemicals. Okay, so any doubt guys? So if you are having any doubt, please mention in the comment section, we will go further. So if you don't know, just mention no, so we will continue. So just please mention in the comment section. If you are having the doubt, please mention the doubt. If there is no doubt, please mention as no doubt. So why means you are spending time and I am also spending time. Without understanding anything, no need to learn. So that is my intention. So please mention the comment section. Yeah, thank you, Balaji. Thanks for your reply. So be interactive so that you can learn, and even I will get the interest to teach. Okay, so be interactive. Just means in the comment section. That's all. Okay. So here first one is we have learned about alphabetic index and tabular list. Okay. Next we need to understand format and structure. How is this ICD-10 CM formatted and what is the code structure? Okay. So the ICD-10 CM tabular list contains categories, subcategories and codes. Okay. Most of the time categories are having 7 characters. Okay. Subcategories are having 3 characters and codes are having 3 characters as well as 7 characters. Okay. So if you go to interview, they may ask you, so how many characters in a ICD-10 CM code? So that time you need to tell them ICD-10 CM is having 7 character codes as well as 3 character codes. Okay. So characters for categories, subcategories and codes may be either letter or a number. So most of the time na ICD-10 code consists of two letters, one letter and one number. For example, if you take I-10, okay. So I-10 means I means letter and 10 means number. So like that ICD-10 CM contains letter or a number. All categories are 3 characters. We have discussed, correct? All categories are 3 characters. Okay. A 3 character category that has no further subdivision is equivalent to a code. For example, you are having the 3 character code. So you need to check in the tabular list whether any other additional characters I need to append or not. Otherwise, you can consider 3 character code as a final code. Okay. Subcategories are either 4 or 5 characters. If you want to code for subcategories, you need to append 4 or 5 characters. Codes may be 3, 4, 5, 6 or 7 characters. So just here you need to remember, whenever you want to code complete ICD-10 CM code, minimum 3 characters, maximum 7 characters. Okay. So you can't code using 4, 5, 6. Minimum 3, maximum 7. Okay. So that is each level of subdivision after a category is a subcategory. So first we are having 3-digit category. Then subcategory consists of 4 or 5 characters. Okay. So the final level of subdivision is a code. Codes that have 7th characters are still referred to as codes, not subcategories. Okay. A code that has an applicable 7th character is considered invalid without the 7th character. Okay. So whenever you want to code 7 characters, you need to code must and should 7 characters. If you code only 6 characters, that is invalid code. Okay. Next, the ICD-10 CM uses an indented format for ease in reference. Okay. So next, we are having third section, use of codes for reporting purposes. For reporting purposes only, codes are permissible, not categories or subcategories, and any applicable 7th character is required. Okay. So whenever you want to report any code, only complete code is required, like 3 character, 4 character or 5 characters. Okay. So you can't consider categories or subcategories as complete code. Okay. So that is the guideline here. Next, fourth one, placeholder character. So the ICD-10 CM uses or utilizes a placeholder character X. Okay. Most of the time we will use this placeholder in the 7th character level. So mostly we will use this 7th character for injuries. Okay. So the X is listed as a placeholder at certain codes to allow for future expansion. If the ICD-10 CM cooperating parties wants to provide any specificity related to the diagnosis, for future expansion they have kept it as X. An example of this is at the poisoning adverse effect underdosing of codes, category T36 to T50. Okay. Where a placeholder exists, the X must be used in order for the score to consider a valid code. Okay. So whenever you see placeholder X, you must and should need to append seventh character. So if you see placeholder X, must and should you need to append seventh character. So that is the guideline. Okay. Next we are having fifth one, seventh characters. Okay. Certain ICD-10 CM categories have a applicable seventh characters. Okay. So the applicable seventh character is required for all codes within the category or as the nodes in the tabular list instruct. The seventh character must always be the seventh character in the data field. If a code that requires seventh character is not 6 characters, a placeholder must X must be used to fill in the empty characters. Okay. So they are telling that few categories are having 7 characters, not 3 characters. So that time if you are unable to find, or if you don't have any code, you need to use the X as placeholder characters. Okay. Next we are having abbreviations, alphabetic index, NEC and NOS. So C's, NEC and NOS are same for this tabular list also. Not only for alphabetic index, this is related to tabular list also. Okay. NEC means not elsewhere classifiable. This abbreviation in the alphabetic index represent other specified. When a specific code is not available for a condition, the alphabetic index directs the coder to the other specified code in the tabular list. So wherever you see NEC, you need to understand that you need to use other specified code. Okay. So for example, in the documentation, if you see, so congestive pneumonia, for example, okay, but you don't have uh, congestive as a specificity. So that time you need to use other specified code. If your alphabetic index does not have any specific code, you need to use other specified code. Okay. This is NEC, not elsewhere classifiable. NOS means this is basically unspecified, not otherwise specified. This abbreviation is the equivalent of unspecified. For example, in the documentation contains asthma. So they did not mention any type of specificity related to asthma. Like we are having multiple types of asthma, childhood asthma, what do you call, and exercise induced asthma, like that. But documentation does not contain type of asthma. So that time you need to use NOS. NOS means not otherwise specified. So NEC means you need to use other specified code. NOS means you need to use unspecified code. Simple. Okay. So next, tabular list of abbreviations. Okay. So there is a little difference between both. We will see those. So these are NEC, NOS related to alphabetic index. Now we need to understand tabular list of NEC and NOS. Okay. So not elsewhere classifiable. So this abbreviation in the tabular list represents other specified. So here also it is other specified. When a specific code is not available for a condition, the tabular list includes an NEC entry under a code to identify the code as the other specified code. Okay. So next week onwards, we will see practically this one. Okay. So in the documentation does not contains any specificity, you need to use NEC code. Okay. So here also same, NOS in the tabular list also not otherwise specified. Okay. This abbreviation is the equivalent of unspecified. Okay. So any doubt, guys? Balaji and Venkata Chalapati. Next, Akruti Desai. So if you don't have any doubt, please mention in the comment section so that we can continue. Yeah, thank you, Balaji. Okay, next, punctuation. Brackets. What are the meaning of brackets? So brackets are used in the tabular list to enclose synonyms, alternative wording, or explanatory pages. Brackets are used in the alphabetic index to identify manifestation codes. Okay. So thank you, Chalpati. Thank you very much for your time. So brackets are used in the tabular list basically. Tabular list to enclose synonyms. So brackets will be used in both tabular list as well as alphabetic index. The purpose is different. In the tabular list, these brackets will denote synonyms, alternative wording or explanatory phrases. Okay. In the alphabetic index, if you see brackets, these are the manifestation codes. Okay. So we'll learn the what is manifestation soon. Okay. Next, punctuations, parentheses. Parentheses used in the both alphabetic index and tabular list to enclose supplementary words that may be present or absent in the statement of a disease or procedure without affecting the code numbers to which it is assigned. Okay. So here also parentheses are used in the alphabetic index as well as tabular index. Okay. So the terms within the parentheses are referred as non-essential modifiers. Okay. So this is very important. So why means sometimes if you want to code chronic conditions in the parentheses you can see chronic. So as I told you next week onwards we will see practically. So chronic. So that time you don't have any indentation for chronic in the index ICD-10 CM index. Why means chronic is non-essential modifiers. Defaultly chronic is in India like chronic is included in that condition. So directly you can code unspecified code. So the non-essential modifiers in the alphabetic index to disease apply to subterms following a main term except when a non-essential modifier and a subentry are mutually exclusive. The subentry takes precedence. Okay, so they have provided one example here. Okay, for example, in the ICD-10 CM alphabetic index, under the main term acute is a non-essential modifiers and chronic is a subentry. In this case, the non-essential modifier acute does not apply to the subentry chronic. Okay, for example, patient is having acute and chronic appendicitis. So how do we code? Here we need to code only chronic. We will not code acute. Why means acute is a non-essential modifier. Defaultly appendicitis includes acute. So we'll code for only chronic. Okay. Why means chronic is subentry. So that is that they are telling here. Subentry takes precedence. Okay. Next colons. Colons are used in the tabular list after an incomplete or which needs one or more of the modifiers following the colon to make it assignable to a given category. Okay. So basically colons are extensors. Okay. So if you see the colon means that code is incomplete. Okay. So we need to append few more things to that colon. Okay. Next, eighth one, use of end. So for that we'll see this one soon. Next one is 9, other and unspecified codes. Other codes and unspecified codes. So both are different, correct? As we have discussed previously, other codes are different, unspecified codes are different. Okay. So when do we use other codes? If there is no specificity related to provider documentation, we need to code other codes. Okay. Unspecified code means the documentation does not contain any specificity related to the condition. Okay. So that is the difference between other codes and unspecified codes. So in other codes, we are having the specificity, but that is not in the ICD-10 CM code book. That time we will use other codes. Okay. Unspecified codes, documentation does not contain any specificity. So that time we'll use unspecified codes. Okay. Next, includes nodes. So basically includes means, for example, if you see like what do you call appendicitis again. So in the includes notes, if you see inflammation of the appendix, that means they are telling that this inflammation of appendix is related to the appendicitis. You no need to code separately. So next we are having inclusion terms. Okay. So what are these terms? Inclusion terms. List of terms is included in under some codes. So here this is the definition basically. Includes node. Included terms means like under some code. Terms included in some codes. We'll see practically next week. So these terms are the conditions for which the code is to be used. The terms may be synonymous of the code title or in the case of other specified codes. Okay. So the terms are list of the various conditions assigned to that code. The inclusion terms are not necessarily exhaustive. Okay. Next we are having two types of excludes nodes. Okay. So exclude one and excludes two. Okay. So whenever you are having two conditions. Okay. So along with this main code, you can't code exclude one condition. Okay. But you can code exclude two code along with main condition. So that is the guideline. So we'll see next week example. Okay. So next etiology manifestation conventions. Okay. So these are very simple. Basically etiology means underlying cause. Manifestation means condition which develops due to underlying cause. Okay. So code first, use additional code and diseases classified elsewhere nodes. So for example, if you are coded the symptom of the etiology like underlying cause, where you will see the guideline code first. So they are telling you to code first underlying cause. For example, patient is having urinary retention. There you will see code first guideline. So they are telling code first what is the reason for urinary retention. Most of the time patient will have urinary retention due to BPH. Okay, so they are telling first to code BPH, then you can code urinary retention. Okay, next use additional code means here they are provided the underlying cause. Now you need to code any symptoms. If the patient is having second patient came in with BPH, under BPH you see use additional code. Okay, so meaning so anyway patient is having the BPH. If the patient is having any type of symptom also you can code. That is the use additional code guideline. Okay, and in diseases classified elsewhere nodes. Okay, so certain conditions have both an underlying etiology and multiple body system manifestation due to underlying etiology. Okay, so what they are telling, patient may have only one underlying conditions, but patient may have multiple body system manifestations. Okay, manifestations will develop due to underlying cause basically. Okay, for such condition the ICD-10 CM has a coding conventions that requires the underlying condition be sequenced first, if applicable, followed by manifestation. Okay, so we have discussed correct BPH, that one. So this is the guideline. Okay, so whenever such a combination exists, there is a huge additional code note at the etiology code and a code first note at the manifestation code. Okay, so if you have coded underlying cause, you will see use additional code for manifestation. Okay, so if you see code first note, so if you see code first note, you need to understand that you are looking the manifestation code, you need to code for underlying cause. So based on these words you need to understand what you need to code. Okay, so when do you code guys? Code first. When do you use code first means what is meant by code first? Mention in the comment section what is meant by code first. Where do you find this one? Underlying cause or manifestation? Write your answer in the chat box. It's simple. Where do you find code first note? Balaji. Chalpati, where do you find code first note? If you go to interview, they will ask you, where do you find code first note? So what do you tell? Yeah, perfect. So under manifestation, you will find code first. Under etiology or underlying cause, you will find use additional code. It's simple. Okay. So in most cases, the manifestation codes will have in the code title in diseases classified elsewhere. Okay. So wherever you see this one, yeah, Balaji Chalapati, thanks for your reply. So wherever you see in diseases classified elsewhere, you need to understand that it is a manifestation, not underlying cause. Okay. So codes with this title are a component of etiology manifestation conventions. The code title indicates that it is a manifestation code. So wherever you see in diseases classified elsewhere, you need to understand it is a manifestation code, not a underlying cause. In diseases classified elsewhere, codes are never permitted to be as a first listed or like principal diagnosis codes. Okay. So if the documentation contains this code in diseases classified elsewhere, okay. So that time we can, so we can't use this one as a primary code. Always you need to use this in diseases classified elsewhere as secondary only. So as it is a manifestation of underlying cause. Okay. So they must be used in conjunction with an underlying condition code and they must be listed following the underlying condition. See this one. So for example, see category F02, dementia in other diseases classified elsewhere. For example of these conventions. So I will try to open this one. So can you see my screen? So what they are telling? So F02 series, correct? So directly we'll go to F02 series. See, dementia in other diseases classified elsewhere. So what is this one? This is a manifestation code, correct? So here they are telling these are the underlying causes, code first. Okay. So they are telling that you can't code this F02 as a first listed or principal diagnosis. Always you need to code underlying cause first. Okay, see here the underlying physiological condition. First you need to code this one, then you need to code this one. Dementia in other diseases classified elsewhere. So that is the guideline they are telling here. Okay. So got it, Chalpati? Yeah, Bhavya, just now I showed you, na? So how to identify underlying cause and this manifestation. So this is the example for this manifestation. So here F02 is the manifestation. Okay. So code first, these all are the underlying causes. Okay. So you can't code this F02 as a principal diagnosis or first listed diagnosis. Always if you want to code F02, you need to code this one first and after one only you can code this manifestation. So basically these are etiology or underlying cause. These are manifestations. Okay. So that is the example for this scenario or this guideline. Okay. Next, there are manifestation codes that do not have in diseases classified elsewhere in the title. For such codes, there is a huge additional code noted the etiology code and a code first noted the manifestation code and the rules for sequencing apply. So what they are telling? So not all codes contains in diseases classified elsewhere for manifestation codes. Few codes are without this wording also. Okay. For them manifestation, you will find the guideline as code first. Okay. And underlying cause, you will get the guideline as use additional code. Okay. So in addition to the nodes in the tabular list, these conditions also have a specific alphabetic index entry structure. Okay. In the alphabetic index, both conditions are listed together with the etiology code first, followed by the manifestation code in the brackets. So previously we have seen brackets, correct? So these are the purpose of brackets. Okay. So in the alphabetic index are both conditions are listed together with the etiology code first, followed by manifestation in brackets. Okay. So the an example of etiology manifestation convention is dementia with Parkinson disease. So how do we code now? So for example, if you are in your documentation, if you see dementia with Parkinson disease, okay, how do you code? First you need to code Parkinson disease, this one, G20. Next you need to code this one, F02 series codes. Okay, so that is the guideline. Okay, so next then must be sequence pair as F0280, F0281 represent manifestation in dementia. Okay, so code first and used as nodes are also used as sequencing rules in the classification for certain codes that are not part of etiology manifestation combination. So they are telling that, so you don't think that only whenever you want to code this etiology manifestation without this wording also you are having the codes. Okay. So always whenever you want to confirm one code, you need to check the guidelines related to that code. Then only you can code it. Okay. So okay guys. So I hope this session is useful for you. So any doubt? So we will conclude this session here now. Any doubts for you? Otherwise, we will start next week. So Chalapati, Balaji, do you have any doubts? So if you don't have any doubts, we can conclude here. Next, we will see next week few more guidelines. Yeah, these are only on weekends. So these are on weekends only. Yeah, thank you, Balaji. So meanwhile, you can learn yourself at home. So if you are having any doubts, we can discuss next week. Okay. Yeah, thank you, Chalapati. So we will meet again on next week. Okay. So once again, thanks for visiting our channel. So if anyone looking for same day surgery coding training, please send WhatsApp message to 707-526-3939. So if you like this session, please click on like button. So if you are having any doubts, please mention in the comment section. And if you are visiting for the first time, please click on subscribe button. Yeah, thank you, Vishwachandar. So thanks for your attendance. Next week we will see few more guidelines. Bye. Take care.